Do you suffer from lack of focus, disorganization, forgetfulness, fidgeting, inattention, hyperactivity, impulsivity, excessive talking, frequent interrupting, boredom, lack of direction? If so, ask your daughter about Adderall. Adderall is a prescription medication that contains amphetamines, and it belongs to a class of medications called stimulants. Amphetamines work by increasing dopamine levels in the brain. Dopamine is a neurotransmitter associated with motivation, pleasure, attention, and movement. For many people with ADHD, stimulant medications boost concentration and focus while reducing hyperactive and impulsive behaviors.
Amphetamines may be administered orally, intranasally, or intravenously. The peak response occurs 1 to 3 hours after oral administration or 15 minutes after injection. Half-life of the amphetamines is 1 to 6 hours, dependent on speed of responders. The bioavailability is 75% after injection and 60% orally. Amphetamines are metabolized by the liver, plasma, and by a range of enzymes, including cytochrome P450 2D6. After metabolized, the amphetamines are excreted through urine. At low doses, amphetamine binds to the presynaptic membrane of the dopaminergic neurons and induces the release of dopamine from the nerve terminal. It binds to the dopamine reuptake transporter, causing it to not only block reuptake, but also to act in reverse and transport free dopamine out of the nerve terminal. At high doses, it interacts with dopamine containing synaptic storage vesicles, releasing free dopamine into the nerve terminal. Also at high doses, amphetamine binds to monoamine oxidase in dopaminergic neurons and prevents the degradation of dopamine, leaving free dopamine in the nerve terminal. High-dose amphetamine has a similar effect on non-adrenergic neurons. It can induce the release of norepinephrine into the synaptic cleft and inhibit the norepinephrine reuptake transporter.
Adderall is prescribed to treat the debilitating symptoms of inattentive and hyperactive ADHD. At low medicinal doses, amphetamines stimulate the release of dopamine and norepinephrine, thus compensating for the lack of these neurotransmitters in the ADHD brain. Adderall is available in both instant or extended-release tablets. The medication is taken mouthfully, with or without food, as directed by your doctor, usually 1 to 3 times a day. Adderall's therapeutic effects include increased heart rate, increased blood pressure, increased alertness, euphoria, excitement, wakefulness, reduced sense of fatigue, increased mood, motor and speech activity, feeling of power. Other side effects at low doses may include loss of appetite, greater increase in motor activity, insomnia, impulsivity, respiratory stimulation, slight tremors, restlessness and attention, hyperactivity, impulsivity, lack of focus, disorganization, forgetfulness, fidgeting, excessive talking, frequent interrupting. Wait, aren't a lot of these symptoms what Adderall is supposed to be treating? Oh, I'm not even done with the list. Effects from moderate to high doses include agitation, aggression, anxiety, obsessive behaviors, paranoia, panic disorder, hallucinations, less dopamine binding, tolerance, dependence, outbursts of violence, and addiction. Discontinue use if you experience continuous, purposeless, repetitive acts, paranoid delusions, severe anorexia, skin sores, hygiene neglect, schizophrenia, death by first use, deteriorating mental and physical condition due to your addictive behaviors.
Adderall is FDA approved for treating ADHD and narcolepsy. It is also used off-label to treat depression and anxiety.
Adderall has been proven to significantly decrease symptoms of ADHD and narcolepsy. Paired with antidepressant medication, it has also been shown to decrease symptoms of depression as an off-brand use. Although therapeutic effects can be experienced, Adderall can also cause serious side effects, and use can potentially lead to addiction. For these reasons, you should consult with a doctor before use and never self-medicate.
Ask your doctor if Adderall is the drug for you.